geriatric. Mr. Speaker, I was here earlier and I stepped out and I had to come back because I needed to register my, sorry, Speaker.
What is geriatric?
Geriatric is matters to do with childbirth. Matters to do with childbirth. And I came back because I really wanted to put my voice on this issue. I have been very, very vocal on matters maternity health care, Mr. Speaker. And it pains me when I see a hospital facility refusing to admit a mother in labor, knowing very well that babies cannot wait. Babies cannot wait for an excuse to look for deposit for a hospital bed. They cannot wait for a doctor to be called on call. Babies cannot wait for anybody to raise a logbook, a title deed, or anything else that they're asking as security in our hospitals. Mr. Speaker, the many times I've received distress calls from mothers who have been abandoned at the reception of hospitals, both public and private, is alarming in this country. Thousands of children, and when I talk about children, Mr. Speaker, I'm speaking about infants who have rights, have been detained in our facilities in the name of you have to pay. So I keep asking, when you retain an infant, a three-day-old infant in a hospital, what is the intention? To sell the baby and recover the money? Why should they retain babies, newborns in hospitals? When you retain a dead body, what is the intention? What do you expect to get? Sell the dead body and get the money? I mean, we have to be realistic and we have to be practical. This must stop. And Honorable Jerry, how I wish that this bill can be adopted as a government bill by whoever, or a committee bill if it is possible. We move it in the corridors of this nation and make sure before the lapse of this parliament, this bill has become a law. It is unfortunate, Mr. Speaker, if you look at the date of this bill, it was published in 2024. We are now in 2026. It means we don't take care, we don't give priority to such serious issues. I'm even worried, Madam Jerry, Mheshimiwa, because I'm a senior member here, I can tell you.
Order. This address is to the Speaker.
Oh, sorry. Mr. Speaker, I am worried that this bill, being a private member's bill, we might get excited in this house and talk about it and support it overwhelmingly like we have had. But before it goes to the Senate and comes back for, for a committee of the whole house and all what happens ahead, I'm worried it might not see the light of day. So I'm appealing to the members of this house who belong to the health committee, those that belong to the budget committee, those that can be able to help us in the leadership to adopt this bill, either as a committee bill or a government bill, so that we can pass it unanimously. I have a lot of interest in it because last weekend, Mr. Speaker, I was in my constituency and I attended 2 fundraisers, one in Mutuya village and another one in Gathanji village. And shockingly, the issues that were in one of the Harambe, one of the fundraisers that I attended, was a pending bill of 580,000. The body is still, even now, detained in Kenyatta Referral Hospital. Interestingly, when I interrogated the bill, I was shocked that these hospitals are actually even adding their own money on top of services rendered to patients. An injection that cost 350 shillings in Ruiru was being billed 1,385. A simple injection. Because these parents, most of them are not able to interrogate the bill. So an injectable, just an injection, just because it was done in the ward, it moves from 385 shillings to 1,300, Mr. Speaker. If you look at those bills, sometimes people die, the bodies are detained in hospitals, but they accrue bills every day. So should I ask, do dead bodies pay rents? Are they supposed to be paying rent? Is it that we are paying for services rendered or we are paying for accommodation in the hospitals' compounds? Look at the bed charges that they are charging, Mr. Speaker. Why would you ask a patient to deposit 80,000 for a bed? Even a bed in a 4-star hotel does not cost us 80,000, Mr. Speaker. So I think this is a very serious bill, and I think we need to do something to make sure that it passes as soon as possible. And Honorable Jerry has done her part, and we support her irrespective of the political positions, because this bill is not Honorable Jerry Miner's bill, it's a Kenyan bill. I stand to support it. Thank you.
Is it Wamudende? This is your chance, sir.
Thank you, Mr. Speaker. I also rise to support, and to many members who sometimes call me Jerry. Jerry is